You know, like a stubborn pimple that needs extra attention. Malaysia's healthcare system has a long-standing issue: overcrowded hospitals. Imagine this. You wake up feeling unwell, maybe a sore throat, slight fever. You head to the hospital thinking this is just a quick visit, no big deal. But when you arrive, bam! The waiting room looks like the premiere of a blockbuster movie. Packed, people are restless, the tension thicker than pus in a boil. And you can see doctors and nurses running around like they're in a medical marathon. We've all been there, right? So what's causing this overcrowding? Is it poor management, lack of resources, or something else? Actually, it's a combination of factors. And like treating a stubborn skin problem, we need a multifaceted approach to solve it. The good news? We can fix this. And the best part? We can do it together without drastic measures. Let's dive in. All right, friends, before we can treat any problem, we need to understand it first, right? Knowledge is power. So let's take a look at what's really happening in our hospitals. We're talking about long waiting times, frustrated patients, and overworked healthcare staff. Imagine waiting for hours with a throbbing headache or a crying child, only to be told you need to wait even longer. It's stressful, it's frustrating, and it's simply unacceptable. To truly understand the severity, we need to hear from those on the front lines, patients spending hours in waiting rooms, and doctors and nurses working tirelessly to provide the best care. Let's put faces to the statistics, real stories behind these numbers. But it's not just about stories, right? We need solid evidence, clear data showing the extent of this issue. This is where useful infographics come in. We're talking about clear and concise visuals that break down complex information into easily digestible parts. Think of it like this. We're performing a virtual biopsy on the healthcare system, analyzing data to find the root cause of this congestion issue. And just like a successful extraction, seeing waiting times decrease after implementing solutions will be incredibly satisfying. Now I know what you're thinking. More rules, more regulations, more headaches. But hold on a second, we're not talking about drastic overnight changes that leave everyone feeling like they're in a medical drama. We're talking about small voluntary improvements that empower you, the people of Malaysia, to make informed choices about your healthcare. Think of it like this. You wouldn't try to squeeze a giant blackhead without first softening the skin around it, right? We need to be gentle, strategic, and offer options that make sense. That's where our express lane for online appointments comes in. Imagine skipping the queue entirely just by booking your slot online. No more waiting for hours on end. Just show up at your designated time and get the care you need. But what about those times when you're not sure if a clinic visit is even necessary? We've got you covered. Introducing free telemedicine for common illnesses. Need a quick consultation for a mild cough or a pesky rash? Skip the trip altogether and connect with a doctor online. It's convenient, it's efficient, and it helps free up valuable resources at hospitals for those who truly need them. All right, everyone, we've discussed the problem, we've looked at some possible solutions, but how do we know if any of this will work? Like a good skincare routine, we need to monitor our progress and see what works and what needs improvement. This is where social proof comes in. Real stories, real people, real results. Imagine a Malaysian sharing their experience of booking an appointment online and being seen by a doctor in minutes, not hours. Or how about comparing wait times at hospitals before and after implementing these new initiatives? It's so satisfying, but wait, there's more. We all love a little incentive, right? So let's reward those who try it first, those who are brave enough to embrace this change and help pave the way for a more efficient healthcare system. Imagine priority services for those using telemedicine or opting to visit health clinics for non-urgent cases. It's a win-win situation. Faster treatment for them and less congestion in hospitals for everyone. Now, I've always believed that the best solutions come from understanding the problem from all angles. It's like treating a particularly stubborn cyst. Sometimes you need to get up close and personal to really figure out the best way to tackle it. And when it comes to our healthcare system, who better to offer insights than you, the Rakyat Malaysia? We're not talking about top-down directives here, folks. We're talking about empowering communities to be active participants in shaping the future of healthcare in Malaysia. Imagine community health committees where everyday citizens can voice their concerns, share their ideas, and work together to find solutions that work for their specific needs. But it's not just about talking the talk, it's about walking the walk. Or In this case, having access to the information we need to make informed decisions. That's where our public healthcare dashboards come in. Real-time updates on hospital congestion, wait times, and available resources all at your fingertips. Think of it like Waze for healthcare, helping you navigate the system efficiently and avoid unnecessary delays. Now, I know what you're thinking. This all sounds great in theory, but what about the implementation? We're not talking about a quick fix here, folks. We're talking about a gradual, phased approach that ensures a smooth transition and minimizes disruption. Remember, we're aiming for long-term sustainable change, not a temporary fix. Think of it like this. Just as we wouldn't apply a harsh chemical peel without proper preparation and aftercare, we need to ease into these changes gradually. Phase 1, voluntary adoption of telemedicine and online booking systems, letting people experience the benefits firsthand and become advocates for change. Phase 2, gentle nudges in the right direction, like small fee increases for misusing emergency rooms or incentives for visiting Klinik Kesehatan for non-urgent cases. And finally, Phase 3, a wider rollout of successful initiatives tailored to the specific needs and challenges of different states. So there you have it, everyone. We've explored the challenges, we've uncovered potential solutions, and most importantly, we've seen how we all can play a role in creating a more efficient and accessible healthcare system for all Malaysians. Remember, this isn't just a government issue, it's a shared responsibility. By working together, embracing innovation, and being prudent in using our healthcare resources, we can ensure everyone gets access to timely and quality care. Imagine a Malaysia where hospital visits are no longer dreaded, where waiting times are reduced, and where healthcare professionals can focus on what they do best, providing exceptional care. This is a vision we can achieve together, one step at a time. What do you say? Are you with me? Let's hear your thoughts in the comments below.